Welcome to Healthcare Quality and Risk Matters, the show where we dive into the topics that matter most in healthcare quality and risk management. Wondering about patient safety, quality improvement, or risk mitigation, but weren't sure who to ask or were afraid to ask? Well, you're in the right place. We create a safe and judgment-free space to explore these critical topics together that will leave you informed and inspired to make a positive impact on healthcare and patient outcomes. So let's learn and grow together because healthcare matters.
Well, good afternoon, everybody, and welcome to this May edition of Healthcare Quality and Risk Matters. My name is Gary Bierc. I'm the CEO of Aperitisoft, and I'm being joined by my two esteemed colleagues, Rob Santamoor, who is our Chief Operating Officer, and Dr. Timothy Brown, who is the Head of Customer Success for Aperitisoft Healthcare as well. We are excited about this month, aren't we, guys? We're talking about a very important topic, dear to our heart, and that is documentation. And you're out there, you're saying, documentation, that's boring. Well, we're here to tell you that documentation is critical. If you don't have the right documentation when you're working through your quality and safety programs, you're going to have major issues when the auditors show up, if there is a lawsuit, and the list can go on and on. So what we're going to do today is something a little bit different, and Rob's going to get into it a little bit in the details, is we're going to break down three aspects of the importance of documentation, or three different perspectives of why documentation is important. We're going to dive into that a little bit more with you today. And hopefully over this half hour, we can give you a lot of great information and why it's important that you take documentation seriously. Mm-hmm. So before we get rolling here, I'm going to ask everybody out there, if you're listening, go ahead and go into the chat. Tell us where you're from. We'd like to know. Tell us a little bit about yourself as well as what your background is. It's always good to know who's watching and how they feel about things. Also, look, today, if you like what you've heard today, give us a like, give us a comment, share us with your friends. It wasn't for you, we wouldn't be here. So anything else, Timothy, we should be asking folks for before we dive in?
No, I think we're good to go. Let's jump into the conversation.
Outstanding. All right, Rob, let's talk about the defensibility.
There's defensibility, of course, like you said, Gary, starts with good documentation. So for those that are audio only at this time, know that we are sharing, there's the slide deck, the document that we're using today for our discussion. And please reach out, to Dr. Brown, there's a high resolution copy of this to bring back to there's health system, there's your department, there's in order to have these really important conversations around ensuring good documentation. There's defensibility test really starts around risk. Are you managing risk both proactively? And unfortunately, when it does happen, are you able to react to risk? So breaking that out to legal risk, audit risk, and culture risk. And what does that mean? Would your documentation hold up in court, in an audit, and does it support the culture you're looking for, i.e. a culture of quality, a culture of risk awareness, a culture of safety. All of those things are formed around what information you're providing to your teams and your stakeholders. As far as legal risk goes, and we can dive into each of these, share examples. If any of you have any examples that you want to share, we would love to hear them. But as far as legal risk goes, very simply, if documentation is missing, incomplete, or doesn't make sense, courts are going to assume the worst. Whether that be the judge, whether that be an arbitrator, whether that be just a couple attorneys getting together to decide on a settlement. Whoever's documentation is better is going to win the case. If your documentation doesn't cover how you responded to a patient situation, if your risk team didn't have good documentation to show how they responded and mitigated that risk for that patient, the plaintiff is going to win almost every time. Again, if you didn't
And
document it, it
let's
didn't
not
happen.
sugarcoat this, right, Rob? You cannot sugarcoat this.
Agreed.
There's no way around it. I mean, let me ask you a very important question here, Rob. We once in one of our shows talked about the audit from hell.
Yeah.
And right. And we talked about this particular hospital that had documentation.
We did. Yes.
But
Absolutely.
and I'm going to put all caps on the but, being able to find the documentation, doing it quickly, connecting all the right dots in a manner in which the auditor could follow, understand, and see that you had your arms around the problem was another question, right?
And a big question at that, Gary.
So,
Yes.
from a legal perspective, I can only imagine that if there is a subpoena for documentation and documentation is coming in fragmented and it's not being well connected and not tied to what was going on, there is going to be a big gap from how the courts view honesty, integrity, character of those that are making their case on either side. Is that a fair statement?
That is a fair statement, and I don't even know that I shared this with you, Gary, but I had this a statement that was an off statement that rings very clearly right now. About a year ago, there's one of our clients. We were supporting them through an audit, and it took me several hours to find the document that the auditor had requested. And when I turned it over to the auditor, and she very simply stated, "Why do I believe you didn't just go in the back room and create this?" And I was really dumbfounded, and I really thought she was just being, frankly, a little rude and unprofessional. But as I think about it, right, I actually had time if I wanted to, and I was a nefarious person. And I was not an ethical person. I could have gone and taken the many hours that I did and created something false. So when I turned this document over, she doubted my integrity.
Yep.
She doubted the document. And I am already losing a ton of credibility with this auditor. And if I'm an auditor, as you know, now I'm going to dig deeper because I need to
Right.
prove
Right.
that these people are doing the right thing.
Yep.
You
Or
know, and
the legal situation could be elsewhere, right?
Yeah.
Absolutely. And I want to give this information too. Full disclosure, we're not offering any legal advice, and I always consult
Thank you.
with the overall attorney.
Yes.
I put
we are not attorneys.
We are not lawyers.
Yeah.
I put that disclaimer in the overall comments, but it just makes common sense back to the conversation to have it written down. Not necessarily written down physically, of course, if that's your system, if that's your manual system, totally get it. But having it somewhere where it is time stamped, where that information can be easily accessible by the leaders in your organization that need that information, especially in the case of a lawsuit. Hopefully, knock on wood, that this never happens to your organization. But if you are a healthcare organization, you pretty much understand if anything goes wrong, that usually leads to some type of action legally. And you want to have everything documented so that it can be easily accessible. It's common sense at the end of the day.
So when we do, I totally agree. And when we do case merit reviews for attorneys, so part of our team, we do legal nurse consulting. There's for attorneys. There's law offices. And we will do case merit reviews. There's to let the attorney know our opinion and say, this case is wide open. Go for it. You're gonna win. The hospital has terrible documentation. There's both on the risk management side, there's both on the quality side, as well as there's the actual clinical side. And their risk processes, risk systems did nothing to protect those providers, not the nurses, not the doctors, not the hospital. So go ahead, sue them. You're going to win. And frankly, you should. It doesn't sound like they did the right thing for the patient. Even if they did, I would have no way of proving that. And it is so disappointing to see there's documentation, or a lack of documentation, there's around, especially a patient injury. Right? In my heart, I want to know that these people did the right thing. And I believe that they did. Doctors and nurses don't go to work every day thinking, I'm going to hurt somebody today. They go to work wanting to do the right thing. But if the documentation doesn't show that, then we have to assume the worst, especially if the worst happens.
Yeah,
And they are going
absolutely.
to lose that lawsuit. I fully believe that. In my non-attorney opinion, and I would tell the attorney, go ahead and, if I was on the defense side, go ahead and settle. Pay them
Absolutely.
whatever they're asking for now, because you're going to lose if you go any further.
It's a difficult situation that you put an organization into, because we're not only trying to protect the patient, but we're also trying to protect the organization
Mhm.
and the employee involved in this overall incident as well. So documentation is going to cover all three spaces, including the patient, the overall employee involved, and the organization as well. It's as simple as just letting us know what happened, when it happened, what you did to overall mitigate that overall issue. And if you don't have a simple or clean way to do this, I can understand how complex it can get when it comes down to, well, did I write it down? Did I not? Where did I put that information in? What system is it overall stored in? It just gets a little more convoluted and complicated. So I think this is an important topic that healthcare organizations should understand, organizationally wise, but also for an individual employee. My job, my duty. What is my responsibility in that? And if you don't have a clear cut process, you should probably start there in understanding how to get that completed.
One last comment before we move on to the next slide. If you're out there and you're saying, what are we talking about here with documentation? We're not talking about, do you have SharePoint and you're putting things in a filing cabinet?
No.
What we're talking about is gathering the right documentation throughout the process of identifying, evaluating, and remediating any kind of incident or safety issue that may occur in your organization.
That's good, Karen.
Okay, so you've got to have a couple things. One, you either have to have a really good indexing system of where all this documentation is that ties to each one of these processes that you do. Or, and this is what we recommend, you have a system that can do it for you. Now, there are a lot of systems out there. There aren't many. Aperitisoft Healthcare is probably one of the only ones that literally asks you to document every step along the way and keeps it all properly organized for you. So, but that is what you need to be thinking about. This is where the rubber meets the road. This is where the cost of poor quality really starts to hit your organization when
That's
you
true.
don't have your ducks in a row. Is that a fair statement, Rob and Timothy?
That is
So
absolutely correct.
yes, and you also, on that, I just want to reiterate your point, having appropriate systems. There's me as the risk manager. I want to know that my information, especially for patient safety work product, is in a non-discoverable, well-accessed, controlled, intelligent space for us to be able to do things like peer review to protect the provider license and allow us to get better and improve reporting.
Absolutely.
If you're using like SharePoint and you're just dropping it into an incident file or something, there's likely there are no discoverability protections. You are not able to protect your providers. And you are not able to protect your organization through that quality, risk, and compliance. There's work product, there's confidentiality, there's non-discoverable disclosures. There's anybody that wants there's additional like training or support around those things, please reach out to us, because I know discoverability can be really challenging. But what I can tell you is likely your SharePoint is not covering that for you.
Let's move on to the next factor.
Audit risk.
Your favorite, Robert.
Yeah.
So documentation during audits, right? Disorganized binders, outdated policies, lost emails. There's immediate red flags, right? There's if I want something there's to be defensible, I want it to be readily available, digitally centralized. There's all of my documentation and communication is closed looped. And then there's supporting evidence to everything that I did or did not do and why. When I walk in with a binder, especially I would say in the last 5 to 8 years, there's walking in with papers. There's immediately the eyes get big. And they're just like, whoa, are you coming at me with like printed paper? Like, what are you doing? And that has its place. right? But for the most part, you do not want to be printing anything. You don't want, there's all of these, there's like kind of mismatched documents that you have to like bait stamp or put a series of Post-its on in order to organize and create a key for them, because you're using 7 different systems in order to prove a point.
Absolutely.
It just doesn't work.
It doesn't work, and it's not feasible, Rob. I think about the number of Post-it notes that I've seen in these types of situations, and it's like, how are you're trying to validate a multi-million-dollar lawsuit with a Post-it note? You know, I mean, come on, we're just 2025 now. If you don't have an electronic documentation system, and you're behind the curve, unfortunately, for a health organization, and one that actually is suitable for the incidences that you're dealing with. That's the day-to-day occurrences that happen.
I had to tell an auditor, let me go find the email because I am told by the CEO that there's an email on this. Those are my words to them. Hey, let me go find an email. The CEO told me there's an email on this over a patient death investigation. So a patient dies. And we need to prove, my job to be there as the consultant is to help support them through this process, make sure that they can prove what they did or did not do. And I have to go tell the auditor that I maybe, hopefully, can find an email around correspondence regarding a patient death.
Wow.
And I was obviously embarrassed. I mean, my face was bright red. I been doing this for a very long time, and that is one of the more embarrassing things that I've had to say to an auditor. And I mean, nobody's going to be shocked listening to this. But the hospital was found to be negligent in that. There was no supporting documentation to show what the true investigation was, but a bunch of people could, quote unquote, speak to it.
Let's bring out another very important point. Okay, now we're getting into the audit side. After thinking about legal, it's starting to compound a little bit, right? And folks, if you think that you can get some kind of AI driven software, it's going to do all this automatically for you, it just doesn't work that way. Somebody's got to put in their thoughts. Somebody needs to key in what they saw, why they felt this was a risk or not a risk. You need to put in what are the root causes to this and what you're doing about it so it never happens again. And by the way, that auditor is going to want to know, what did you do when it happened?
Yep.
Correct.
Right? Did you follow protocol? Did you do all the right things? All that must be documented and be documented fresh. Not, Nurse Jones, we had this incident on the floor. Do you remember exactly what everybody did at the time?
Yep.
3 weeks. That's not appropriate.
No.
So again, you need systems in place, whether it's software or manually, but you need to have it in place where people are not only able to report quickly, but are not penalized for doing so.
Correct.
And to be able to have systems that allow you to assess your audit risk proactively.
Yes.
That's good.
Score it.
Instead of just waiting for the Department of Health to show up for a for-cause investigation, like a patient death, or waiting for a lawsuit to roll in and then respond to those outside entities. Assess your risk ahead of time. Find out that your frontline team doesn't document incidents like they should. Learn that now. Do education, set expectations, measure it, monitor it, and maintain it through your systems. And that way, when the auditor comes or the attorneys come, you can say, we are not negligent. We are not doing things out of gross negligence. We are doing things in a system of quality where we are continuously improving to reduce the risk to our patients and improve their outcomes. And to be able to share that intelligently, to be able to share that in a way that instills a ton of confidence, in the auditors, and frankly yourself, right, as a professional, to be able to state, I know for a fact when I go to sleep at night, we are doing the right things for the right reasons.
Wow. Right. You use the forbidden word in healthcare. proactive.
Yeah, that's a big word.
For some reason, we are afraid of that word, only in slogans, I will say. But when it comes down to the work, we are just in that. I'll speak to this, from as being in healthcare for over 20 years. We do not do proactive for some reason, and it needs to become ingrained in the work that we do day to day. Every department, every leader, every individual in the organization needs to take that word and let it be ingrained into the work that they do. You need to learn how to be proactive. That's the only way we're going to prevent some of these issues from happening.
Yep.
Agreed.
As we're moving into the last risk factor, if you've got questions out there, folks in the audience, please give us the questions in the chat. We want to cover those before we wrap up the podcast for this month. And your comments as well. Your insights are important so that others can learn from what you've experienced as well. So, Rob, why don't we move into the last one, which is probably the most important one.
I fully agree. And I am so glad that you opened it with that, because the culture around quality, risk, and compliance will absolutely be the main dictating factor of whether or not your organization does the right things for the right reasons. And if you have, there's, binders laying around and there's no infrastructure, people don't know there's what document to look at, how to document, what's expected, and frankly, how to keep their patients safe, how to keep themselves safe. Culture is terrible. You're going to have high turnover. And you're going to have unsafe, situations, well, we'll call them for your patients, on the continuum. On the PowerPoint here, we identified it. There's risks if the staff fear retaliation and don't believe in the process, incidents go unreported. This is also true. There's having a just culture where we are encouraging incident reporting. Makes all the difference. There's one person auditing. Even if one person was auditing daily, are not going to capture the actual or potential risks that 2,000 employees would capture if all of them were reporting, hey, that felt weird. I did nothing bad happen, but it could have. Let's report that near miss. There's great. We identified something. We can stop bad things from happening in that space. Or something did happen and they're reporting it right away and we can address it. And then we'll have good documentation for our auditor or our attorney.
Yeah. That's good. So Timothy, you've got lots of thoughts on this.
I do.
How important is culture in improving quality and safety in a hospital?
I rank culture honestly at the number one, at the very top of any organization's understanding of improving quality. Reason being that, of course, as Rob said earlier, if this is not ingrained into your culture, we can talk all day. Your leaders can talk all day, but if it's not ingrained to the overall fabric of your organization, the likelihood or the chances of things changing in a positive way are going to be slim to none. And when I say building it into the fabric, I mean the everyday conversations that you have, your QAPI meetings, your individual roundings that you have, your monthly meetings, your individual one-on-one coaching with teammates and leaders. If that's not building to the conversations that you have, and there's no follow-up process of it, employees aren't going to do it. And they understand if they don't feel that the organization takes it as important as it should be, they're not going to add any additional work to their overall workload. Let's be honest. Healthcare employees are exhausted. They're tired. They are completely overworked. They're understaffed in certain departments. And that all leads to a great storm of things that can potentially happen to patients and everyone involved in any type of situation for the organization. So I rate culture at the number one, because as you continue to build that culture, what's important, what you continue to talk about, what you continue to put effort into for the organization is going to actually bleed out, if you want to call it, throughout the entire organization.
I hear so often through high turnover investigations, right? Like get a call from a client. We need to figure out why we have such massive turnover in our organization. I hear a lot of examples that come back to a culture of quality, safety, and risk. And the examples such as I never know what's expected of me. I keep getting in trouble for doing things that I didn't even know I was supposed to do. My leaders never have an answer for me. They don't know what our policy or process is. I don't know what our policy process is. And I could go on with a whole bunch of rhetoric that all sounds exactly the same, that really comes down to you have no control over the black and white information that is available to your team and the expectations that are approved by your board, by your leadership. That trickle all the way down from the person hired today to the person that's been here for 35 years and CEO of the company. When people don't know what's expected of them, and people do not believe that you are going to follow up on their concerns or the incidents, because there's no loop closure, people are going to get discouraged and they are going to leave. There's not a single one of us in healthcare can afford to lose one team member for a bad reason.
Now, as a senior business leader, I have our final comments on culture for senior management in the healthcare community out there. If you're struggling with quality, the worst thing you could possibly do is to put negative pressure on people not to report certain things.
Correct.
It is not your job to decide from your executive desk what should be reported and not reported. If you really want to work towards a organization that is a top-ranked safety and quality and risk organization, you want reporting to be as fluid as possible. And you want it to be easy for people to report. Why? Well, we want to get at the bad stuff. And if people are afraid to report, we're not going to know about the bad stuff. And why do we want to know about the bad stuff? We want to know about the bad stuff so we can correct it and get it in place. So look, after that, if the only thing it's getting reporting is that Bob got a hangnail, then that's a good thing.
That's correct.
Yeah, that would be,
right?
It's amazing.
Okay.
Yes.
That is a really good thing. But if we're no longer having bed sores, we're no longer having infections from IVs, we're no longer having falls, or they're very rare anyway, that's where we want to work towards. We want to work towards a major change in the environment of the hospital so that your public, those who want to come to you, know that it's safe. That if I'm going to get a very difficult procedure, I want to come to your hospital because I can trust you.
That's good. That's great.
But if you put this negative pressure on people, you're not getting anywhere. Second, quit trying to manage to metrics. Metrics are a way to look at what you're doing, not for you to manage to them. Right? They'll fall out in the positive light if you do the right things. But if you try to manage to them, you're going to fail every time.
I love that so much. Adding metrics to your strategic plan, great. But there's constantly managing just to a data point. There's, instead of a concept, a function, a design, you're just chasing your tail all day, every day. And you're not making sustainable long-term decisions. You are being short-sighted and reactionary. It's one of the things that I was taught day one in nursing is stop titrating your Levofed every couple minutes. Give the body a minute to catch up and look at your patient, document your assessment, and review that before you make another change. And that is the same thing that you're saying, Gary, right? Like applying those basic clinical principles that we're learning at bedside, to the smarter functions of operations. Managed to the long-term goals that achieve better patient outcomes. And help improve healthcare, higher patient safety, higher quality. The metrics are going to follow that, rather than you chasing a data point.
Exactly. And that's what leadership is supposed to do, and then encourage that the organization does those things.
Yes, reward it.
Absolutely.
Have a culture that's exciting. You get excited about it. You celebrate it.
It's like being a great football coach. A great football coach doesn't go out there and say, we're going to manage to the scoreboard. That's impossible.
Yeah, that's true.
Right? You can't do that. Everybody wants to win. but you need to get into what the details are. That is where the devil lives. And what does that mean? I need lots of reporting. I need lots of metadata. I need lots of stuff that I can react to so that I can manage the whole organization towards the big metrics eventually. But you can't come out of the gate saying that we're gonna score more than everybody else. Okay. Okay, how are we gonna do that?
Right. Be like, you're stating the obvious. You're stating a data point, but like, what are we doing?
Right.
The how is important.
The how is important. And
So,
you need to,
we're at the end of our half hour, Rob, believe it or
wow,
not.
that went really fast. I feel like I have so much more to say.
Comments, questions, let's get those up on the board before we wrap it up for today.
And so it actually looks like we organically answered most of them. I'm just going to pick, just for the sake of time, just like the first 5 that popped into our meeting and just say, there's hello. There's, hi, Sydney.
Wow.
Thank you for joining. There's, and Angela. Oh, hi, Angie. There's, I know Angie.
You know Angie.
There's, I do. There's, Mr. Jimmy. How are you? There's, I know Jimmy.
Okay. Hey, Dan's back.
Hey, Dan.
There's, and then everybody else for joining. Thank you so much for joining. There's, and we are a minute and a half over.
Well, everybody, look, we really thank you for being part of our show today. We are going to have an after show, and we invite you to go and follow us over there as well. That would be, is this being recorded for the after show? Or is it going to be live today, guys?
There's, I think, both.
Okay. So you'll find us there on YouTube.
Absolutely.
And any other details we need to give them for that?
No, I placed the link in the chat so they can actually join us in about 5 minutes for the after show.
Very, very good. And next month, guys, we're going to talk about the pathway to quality. That will happen on June 25th, noon Eastern time, for those who are in the Central Time or somewhere else in the country. Thanks again for being part of our show this month. We really enjoy putting these shows on for you. Hopefully we are making a big difference. If we are, like us, comment, share us with everybody. We love to keep this show going for as long as possible. Any other final words from you guys?
No, see you guys in the after show.
See you in the after show.
See you in the after show. Bye now.